Hi everyone, my name is Abri de Bruin. I'm a reproductive medicine specialist and an advanced endoscopic surgeon from Pretoria, South Africa. I've decided after 25 years of experience in reproductive medicine and 20 years of doing deep infiltrating endometriosis that it's time that we have an awareness campaign about endometriosis for patients. The reason why I only decided to do it now is a very good question. I think it's long overdue, but the problem is that not all the right information is outside, and we all know that patients come to us and tell us, I've Googled A and B and C and D. So I'm going to be presenting a series of endometriosis topics, and we'll be looking at aspects like what is endometriosis? Where does it come from? What causes it? How do we diagnose it? What age can you start getting endometriosis? What about endometriosis and my fertility potential? What about endometriosis and my quality of life? Why don't anyone believe me when I say I have pain? Why should I continue suffering? What happens if I have endometriosis in different organs? We'll be touching on endometriosis in the bladder, endometriosis obstructing the kidney pipes, causing patients to lose their kidneys. I have patients that need renal transplants because they've lost their kidneys from a simple thing like endometriosis obstructing the kidney pipes. We can't allow that to happen. What type of surgery must I have? Is open surgery indicated? Short answer on that is no, but we'll expand on that in that topic. And we'll also look at endometriosis in the bowel, and endometriosis in the uterus, and endometriosis on the diaphragm. And yes, I'm talking about endometriosis on lots of different places that you didn't even think that you can have endometriosis. And like one of my patients' husband said to me the other day when his wife went to undress for the examination, he said to me, "Doc, you please need to do something because my wife, she's not in a good space and I'm suffering." And I said to him, "Sir, I can tell you now why your wife is not in a good space. She's had 2 open surgeries. She had a hysterectomy. She still has a bleed every month. She still has pain. She's still struggling to pass stools. How would you feel if you've had surgery to alleviate all these symptoms and after 2 open procedures, you still have exactly the same symptoms that you went to the doctor the first time?" We need to address this. We need to share information, the right things outside, so that partners can understand what their wives or their partners are going through. And yes, there's good news, but we need to make sure that we tailor the news, and we need to make sure that you know what the right things are that you should ask, what are the right questions to ask your doctor, and when you should be wary of treatment options that is being offered to you. So we should be asking the right questions, and we should be asking our doctors the right questions and our partners the right questions. And when should we be wary about some advice that we're getting? When should we be wary about information we receive about surgery that's planned? So in this series of talks about endometriosis, I will delve into every one of these topics that I alluded to, and we'll go through all of them so that at the end of the day, you'll be informed about what current standard of practice is, what should happen, and how you can improve your quality of life. The most important aspect for me is your quality of life and your reproductive future. And I hope that we'll be able to assist you all in this journey. I'll see you soon.